Hello everyone, welcome to Patient Education. In this video, I'm going to be talking about stroke. So let's get started. What is stroke? Stroke is when the brain doesn't get enough oxygen because the blood supply to the brain is cut off. This can happen due to a block in the artery, we call it as ischemic stroke, or due to a rupture or tear of an artery that causes bleeding inside the brain, called as hemorrhagic stroke. As a result of both, the brain cells get damaged. The blockage is created by a clot that can be formed locally in the artery, or it can travel from heart through circulation. Risk factors. Let's see who gets stroke. Someone with high blood pressure, high cholesterol in the blood, someone with diabetes, those who smoke, people with pre-existing heart disease such as irregular heartbeat or problems with heart valves, those who are obese, people who have a sedentary lifestyle are likely to get stroke. Signs and symptoms of stroke. It depends upon the area of the brain involved. Sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble in vision in one or both eyes. Sudden trouble in walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause. What is transient ischemic attack or a mini stroke? It occurs when the blood supply to the brain is briefly interrupted. Now, this is a warning sign of an emerging stroke. That is why it needs urgent medical attention, even though there is a complete recovery within few minutes to 24 hours. Now, stroke is a medical emergency, and anyone who develops sudden signs and symptoms must seek medical help. That means you have to go to the hospital straight away. Why is it important to get medical help? Is because there's a window period of 3 hours. We can prevent brain cell damage, and we can also avoid any long-term disability with early intervention. How is it managed in the hospital? Once you arrive at the hospital, the doctors will run blood tests, CT scan, and an MRI. The blood tests are performed mainly to check the levels of sugar and cholesterol. CT scans show whether there is a clot or a bleed. An MRI reveals the area of the brain involved. These are important to decide the course of treatment. The treatment can be either through medicines where they try to dissolve the clot, or through surgery if there is a bleeding. What is the outcome of stroke? It depends upon a number of factors such as age of the person, pre-existing medical conditions, the cause of stroke, whether it is a bleed or a clot, and the extent of damage to the brain cells. Some patients recover completely, others may develop permanent disability, and a few may not even survive. Let's see how strokes can be prevented. They can be easily prevented by identifying and reducing the risk factors and making some lifestyle modifications. Risk factors such as high blood pressure, high cholesterol, diabetes, and atherosclerosis, which is hardening of the arteries, they must be kept under control through regular medications. This reduces the risk by 80%. Now, lifestyle modifications are diet. Avoid fried food and fast food. Include lean meat, chicken, fish, and fruits and salads in your diet. Exercise, no doubt, it is always helpful. Maintain a regular exercise regime. Walking half an hour a day, joining a gym, or working out at home is always beneficial. Avoid smoking, avoid excess alcohol, and maintain an ideal body weight. Now let's see what is the long-term care of patients who recover from stroke. Physiotherapy and speech therapy are quite helpful to restore the normal function of the arm and leg, and people with speech difficulty benefit from speech therapy. The aim here is to improve the quality of life. So remember, never ignore the early symptoms of stroke and always seek medical attention early to get a quick recovery and a better outcome. That comes to the end of my video. I hope it was helpful in understanding stroke. Thank you for listening. Don't forget to like and subscribe to my channel. Bye for now.